This is a follow-up video on the Stop Hurting Your SI Joint video where I talk about the most important things to avoid to stop continuing the SI joint problem. So we're going to talk about what you can start doing now and how you can reintroduce some of those activities that you were avoiding. So there's two phases really that you want to look at this like. So the first phase is stabilization, and that's where you're kind of avoiding some of those activities from the other video, and also we're trying to stabilize the joint with strengthening your glutes and your abdominals and lengthening the hip flexors. And so you're going to do activities kind of like the bridge and the butt buster, which I'll demonstrate in a minute. And then phase 2 is going to be the progression phase, where you're reintroducing activities, you're continuing to strengthen the glutes and the abdominals, continuing to lengthen the hip flexors, and also starting to reintroduce some of those activities that you were avoiding before, because we don't want to get stuck having to avoid them forever. And so I'll demonstrate a little bit of a routine that you could do, and this is a long-term strategy. So phase 1 is kind of like maybe 2 to 4 weeks, and phase 2 can go on for months. And it's not just like you switch from phase 1 to phase 2, it's more like you gradually transition, because that's what the body likes the most, is gradual change and adaptation rather than major abrupt changes. So phase 1, you would do something like, I'm gonna go this way, something like the bridge, where you're actively strengthening the glutes. And I teach a very specific way to do the bridge in the program, and I would always warm up by activating my deep abdominal muscles before doing this, but we're gonna skip to the fun part, and we're strengthening the glutes and also simultaneously lengthening the hip flexors. You don't have to come up all the way. Listen to your body, feel what it's telling you, and make your decisions based on that. This is a stretchy band, and we put it around the thighs above the knees, and you're going to come up and bridge up with this resistance, and we're going to push out into the band. And this is one of those exercises where you can go to fatigue and really burn those glutes out, because it's one of the most effective exercises I know to stabilize the SI joint. So again, we're strengthening here. Abdominals are active, and that's something I talk a lot about in the program, is just engaging these and making them part of the movement. You really want the glutes and the abdominals to work together as a force couple that is providing a drive to your pelvis and your hips. Now, again, we're simultaneously lengthening the hip flexors. So this is a symmetrical, bilateral exercise that is accomplishing all the goals that we want. It's literally perfect in so many ways. So that would be a great phase 1 strategy to do. And then let's get into phase 2. So phase 2 is going to be, like I said, reintroduce activities that you were avoiding before. So a great one that I think is a safe activity to do is a squat. So you can just go as deep as your body will allow you. And remember, a deep squat where you're all the way down sitting on your heels is one of those activities to avoid. So a good example of progression, this phase 2 of progression, is to, over a period of weeks and maybe even months, gradually increase the depth of your squat, as long as you're listening to your body and responding by what it's telling you. If you realize that the next day you're pretty sore after going that deep in the squat, then that's your body telling you, okay, that's the limit right now, or maybe even a little less than that. So you're going to play right at that threshold, and over a period of weeks and months, maybe you can get a little deeper, and that's the progression. Okay, so that's a good initial activity to reintroduce, because it's bilateral, it's symmetrical. Remember, those are some of the concepts that we talked about in that Stop Hurting Your SI Joint video. So what about asymmetrical activities? What about lunges? What about unilateral activities? So this is one of those things where the progression is going to be incredibly important, and that a lot of people ask, can I do lunges? Well, the main thing you want to be aware of is you don't want to go to end range, where you're no longer using your active muscles to hold your pelvis and spine together, and you've gone through that active engagement, and now you're stressing passive tissues like ligaments and even into joint structures like capsules and stuff like that. So for a lunge, you want to start with a really controlled environment and really engage the abdominals and the glutes, and see if you can just go a little bit into the lunge. Remember, this is all about progression. That's phase 2, is progression, reintroduce. So yes, you can do a lunge, but maybe not a full lunge quite yet. And eventually you might get to the point where you can go a little deeper and you can stay engaged. You can stay engaged. I'm protecting that joint, and I'm not going through the active muscle tissues into the ligaments and stressing the actual joint. Okay, and so that's a good example of how to reintroduce. And then I'm going to throw in this little hip flexor trick that I talked about in a previous live stream. Whenever you bring your leg down from something, the hip flexor tends to pop. And people have noticed that with exercises like the dead bug or dying bug, every time, or bicycle sit-ups. Every time I extend my leg and bring it back, my SI joint pops right there. So I have this little hip flexor trick, this SI joint trick that I use, and that is whenever it's okay to bring your leg up, but it's actually the lowering that causes it to pop. And so what I do is I grab the back of my leg, and instead of controlling the lower with my hip flexor, I actually push into my hand and push with my glute. And that is a little trick of the body called reciprocal inhibition. So by using the glute muscle to push down, I'm turning off the hip flexor, and it doesn't allow that hip flexor to pull on my pelvis and my spine and cause that joint to pop. And so I just wanted to show you guys that this is a trick that's been really effective for me. You can use it throughout your life, getting in and out of a car, getting in on and off the bed. Just push down rather than lower against gravity, which sometimes you'll hear a little pop in the back. And so then eventually you can get into a full lunge, which would involve basically, it's a little bit more extreme of a position where you actually can get deeper into the hip flexor stretch. And this is something you want to be extremely mindful of. You want to keep that core engaged, keep that glute engaged. This is a theme throughout, right? And if you're going to drop down and get that stretch in that hip flexor, you don't want to lose that tug of war battle that this muscle group is playing against the abdominals and the glutes to stabilize that pelvis and your spine. So you can drop lower, but don't go through those active muscle tissues. And eventually you can work your way up. This is over weeks, this is over maybe even months, and get down into a full lunge, and there you go, you're getting that hip flexor stretch again. So this is the strategy that I would recommend. And let's talk quickly about passive stretches. The last thing I just wanted to say is a lot of the things that we were avoiding in the previous video were passive stretches. When can I start to reintroduce those? And actually, I don't really think it's important to reintroduce passive stretches into your life because they don't serve a lot of long-term benefit. They may feel good in the moment, but they don't seem to last. And the types of stretches that are the most long-term, that have the most long-term benefits, are active stretches, like a lunge or like yoga. And these passive stretches that are just pulling on your tissues in a passive way could potentially be causing more harm than good. So I would stick to active stretches, and if you take on this strategy, and you may need to add some other things, like I've made a lot of other videos about SI joint, like sleeping positions, the use of an SI belt with a good strategy. I think it's really possible, very possible, for you to get out of chronic SI joint pain. So hopefully that helps. Feel free to share this video with anyone that you know that this might help, anybody that you love or care about, and help spread the word that there is a solution to chronic lower back pain. Hello everyone, and welcome to another week of Core Balance Coaching. So that was a little preview of one of our, SI joint videos that's going to be coming out soon. And welcome if you're here live. The benefit that you get is you can ask me some follow-up questions, and I have some follow-up thoughts on that video. I see the chat here, and I know that a lot of people, what they're dealing with is, somewhat of a more acute situation. So like I see Anna Arts. So you've been hobbling around, you have a sprained SI joint. So, the phase 2 stuff isn't going to be so relevant to you. And so I'll be able to get into a little bit of that right now for you and just make some more notes and suggestions. If at any point you find any of this helpful, feel free to hit that like button and support the stream, support what we do. And thank you all for being here. So some initial thoughts on what I was talking about in that video. Phase 1 is going to be, very critical. It's going to be the period where it's going to be even more important to avoid the things that are contributing to your problem. So I want to emphasize that if you have not seen that video that is dedicated specifically to activities to avoid, and you're dealing with SI joint pain in an acute or chronic situation, you should watch that video. And then, so a lot of the questions that I've had from that video is, what can I do? And so this video is kind of the strategy that you want to take. Of course, the bridge is not the only exercise that you can do, but I do recommend it as one of the, if not the best thing you can do. And if you don't have a stretchy band, it's okay to do the butt buster bridge with just a belt. I think everyone has a belt, and actually a belt can potentially be more effective than a stretchy band, especially if the stretchy band is not very strong. If it's like one of those yellow ones, TheraBand, and it's pretty easy to push out, you're not going to get the same effect as you get from a really strong one. And even one that doesn't stretch, like a belt. What it is, it's the pushing out of the thighs into the band that closes. It causes a force closure of the SI joint. And it not only helps to stabilize it in that way and strengthens the glutes, which cross the joint. It's one of the only muscles that crosses the joint and can actually provide a long-term stability for it. But that move can also potentially, if you're out of alignment, it can realign the joint. And I've had that happen where, you push out hard enough with a lot of force into a belt, or, in physical therapy, I've just used my hands for a patient to push out into, and experienced a little bit of a jolt. And it's that joint just locking into a better alignment. It's not going to be getting out of alignment from doing that, because you're taking your glute muscles and symmetrically forcing that joint into a closed position. So it's a phenomenal exercise for different reasons. And then, one that you want to use to regularly strengthen those glutes. And it is important that you're doing the bridge in the right way. So, I am talking mostly to core balance training students when I say, we do the bridge in a specific way. And if you have not done the program, you're not a student, that's okay. We do teach the bridge for free to everyone. It's in the free trial, a 7-day free trial, and that's all you have to do to learn the bridge the right way. And that can be a life-changing thing to learn, and to do it in a way that's not harming your body. It's a vulnerable position to put your body in, to get that hip extension, and it's really easy for that extension to go into the spine and let have the hip flexors be pulling on the pelvis and the spine in the wrong way. And so we just do it in a really step-by-step deliberate way, and we take it real slow. We take 4 days to learn the bridge. So if you're not a student, I just wanted to throw that out there. And that's the first period of time, is that you can just pretty much do bridge stabilization, add that butt buster element, and avoid the things that are causing the problem. And you can see a lot of progress just from that. I really do emphasize avoiding the things that are irritating it is extremely effective. And then if you're looking like, what else can I do? Can I only do the bridge? Another thing that I think can be really beneficial for the SI joint is simply just walking. And you would want to walk after you have kind of warmed up your core muscles, maybe done a session of the bridge to lengthen and your hip flexors and just warm up and engage all those healthy muscles, and then immediately follow that up with a nice long walk. And I talk about this in some of the other videos where the first 5 minutes of the walk, you might have a little bit of pain in your SI joint, and you might be like, I know Anne mentioned you're hobbling around. That is from the walking, actually. So it's like, why would you walk and say to go for a long walk? Well, walking is a really natural, healthy movement, but what it also does is, as you're extending your leg and the stance, I can't get too deep into the terminology, but in the stance phase of gait where your leg is behind you, it's lengthening the hip flexor, and that's putting a little stretch into it, and that causes pain in the joint. However, as you walk longer, those hip flexors start to warm up. And when muscles warm up, they get more elastic, and the pain can actually go away. If you're, after about 15 minutes of walking, it can actually start to feel better, and your body starts to feel loosened up. And then the walking is just providing you more benefit by functionally using that muscle in a more lengthened, warmed up way. So that's another thing you can do. And squats is, they're not a thing to avoid unless you're going too deep. So I would say squats you could do in phase 1, but you just got to be careful. I wouldn't be doing too much weight, and I really want to emphasize, just like triple down emphasis on the abdominal and glute couple, the force couple of those muscles working together to be the driver of any kind of pelvic, hip, spine motion. It's the lumbopelvic hip complex, we can call it. They all work together in unison. And if you really think about that word, lumbar spine, pelvic, pelvis, hip complex, those are 3 major different areas of the body, but are joined together and made stable by the abdominals and the glutes. And so if you can tell, my emphasis is much more about how you're doing things, more so than giving you 15 different exercises to do, because it's not so much about what you are doing. It's really a lot more important how you do it, how you're engaging your body. And I think the bridge is a really good training ground for learning a healthy way to engage your body that you can then apply to other things. So hopefully that makes sense. I'll take a look into the chat. We do have a bunch of questions today from the Student Hub, from students in the program. So we'll get to that, but I'll take a look in the chat. I'll answer a number of questions now, and then I'll probably have to come back to the chat later. I feel like there was one other thing I wanted to say, but hopefully it'll come back to me, and we'll just look into the chat now. So let's see, how do we want to do this? Does that work pretty well? Works good enough. All right, so Anne had the question. Sherry, thank you for answering. Anna, we talked a little bit about what you're going through and why the walking would cause pain. And there is something to be said about, the fear associated with re-injury. So I've talked a lot about fear avoidance behavior. And I think one of the best ways you can deal with this is, if you're going to decide to do something, do it confidently, because to do things with fear actually changes the way that you relate to your body. It engages kind of a protective mechanism that can be it can be a loop. It can reinforce the problem to be doing things in a protective way. The hip flexors are a protective muscle. So decide before if you're going to do something, and then if you say, yes, I'm going to do it, then do it confidently. And that's the best way you can go about it. And if you think that thing is potentially going to hurt you and set you back, then decide not to do it. And then you don't have to do it in fear. So let's keep going down. So colon, SI joint, stiffness, weakness. Okay, so, and then you have another post down below. You've tried these things. So this is the main thing I'd want to comment on. So stretching is not going to be beneficial for the SI joint, even if you find resources that tell you to stretch your SI joint. I would really what I would do is don't trust me, don't trust that resource. Try it for yourself and make your own opinion. But I'm here saying that I don't think stretching, like in a passive sense, is going to be good for the joint. Most SI joint problems are related to instability, and that's why when people get SI joint surgery, it is to fuse the joint together. They're stabilizing something. So you don't really want to stretch an instability. It's the same thing as a sprained ankle. You don't stretch the sprained ankle, you put a brace around it. So that's what you want to do with your muscles. And you said you've tried strengthening, I'm assuming piriformis, because it's like people say, oh, it crosses the joint. But piriformis is a tiny little triangle muscle about the size of like the gap between my fingers. And I don't think it has a whole lot of power to stabilize compared to something like the glutes. The glute min, glute med, and glute max are really much more effective at stabilizing a joint like that. And so that's why I recommend butt buster and glute strengthening. And then the adductor is going to be part of your antagonist, your enemy. So in this whole complex, it's more together with the hip flexors than anything. So I wouldn't be strengthening them so much. I just kind of would more so just disregard for a little while and be more focused on the sagittal plane, front to back stability. Front of the body, back of the body, and get really stable there. And then after you do that, you can start addressing side to side, frontal plane stuff. That's my recommendation. Sue, car accident related SI joint pain and leg length discrepancy. So, whether or not it's traumatic in nature or a chronic where, it came on gradually and there's no mechanism of injury besides just muscle imbalances. If it's been going on for long enough, it even a traumatic cause becomes chronic in the sense that it becomes muscle imbalances. And ultimately, and this, I just remembered the thing that I was going to say before. This whole thing that we're battling is kind of like a dance between muscles, and the body that goes into protection mechanism is tightening specific muscles to protect the body and bring it into fetal position, and the hip flexors are one of those muscles, and the glutes and the abdominals open the body up, especially the deep abdominals. When I talk about the abdominals, I'm not talking about the six-pack abs. Those are for movement. They are a crunch muscle, but the three layers of abdominals underneath that, the deep abdominals, are compression for helping you stay tall, nice and tall, like a corset. So it's a dance between learning how to engage these healthy body opening muscles and learning how to work with these other muscles, these antagonists, the protective muscles, and learn how to lengthen those without going too far beyond your threshold and maybe causing a setback. You have to learn how to lengthen the hip flexors, but lengthening them too aggressively can set you back. So you got to do it gradually, and it's more of an art than a science, and that's why the listening to your body is so important. So that your body tells you what you are doing right and what you're doing wrong if you listen to it. And it doesn't involve just feeling the pain and saying, no, I can't do that. It's a lot more, it takes a lot more reflection than that. Sometimes you are in pain today because of something you did yesterday. Actually, more than sometimes. It's really common. So it takes reflecting back and going, what did I do yesterday? How far did I go? How intense did I go? How frequently am I doing it? And let's adjust. Let's make an adjustment based on my previous experiences and this knowledge that I'm continuing to build and just develop this awareness of my body over time. So that was a huge tangent and a bit of a soapbox. So, all right, let's go to the next one. That was where I lost my place. You're very welcome, Stars. MPE, thank you for the support and just sharing your experience. And I guess, yeah, I don't know, popular or not, that's not why I'm here. I'm here to share experiences that I've learned the hard way so people can get there a little faster. So, but thank you for the support. Thank you, Kara. Heather, how do you feel about dry needling to assist in releasing the hip flexors? That's a good question. I am not against it. I think that it's a very effective thing, and I have a lot of training in dry needling. However, if you go ahead and release the hip flexors and you do not replace that support that they're providing for the spine and the SI joint and all these things, they are supporting it in a different way, a protective way that doesn't really allow you to function in the way that you want to. It doesn't promote walking. It protects the body in a more fetal position type way, and that is supporting it to, like a turtle closing up, or like any mammal at least on the planet. It's the same reaction. And so if you release that protection, you have to replace it. You have to support it with something else, hopefully the glutes and the abdominals. But if you don't, you're not going to feel very good. I've experienced that myself. I've had my hip flexors released both through the back through dry needling and also through the front. They went through my abdomen, my lower abdomen, not through my intestines, but to the side and into my spine, basically from the front. And it was extremely effective. It released my hip flexors, and I felt like I was I just felt like a dummy or something. Like my body felt all disconnected and discombobulated, and I really just felt like I wanted to just lay down, because the more I moved, I felt like my joints were not working right for a while. So yeah, personal experience with that within last year, labral tear, FAI, knee surgery. Yeah. So, this monster of muscle imbalances that underlies a lot of these conditions that's just what it is. It can have so many effects on the body, from the back to the neck to the hips to the knees. And instead of addressing each problem individually, the harder thing to do is to address that monster. And then you first got to learn about it. You got to learn about the predictable pattern. And if you can take steps to bring your body back into balance, you will notice that a lot of these things will get better. And even if the surgery happened or not, it's still important to address the root of the problem, regardless whether you get surgery or not. It can improve the outcome of a surgery. So, it will improve the outcome. So, just, I guess, encouragement to you, Heather. Shelly, CBT is helping. Oh, that's good to hear. You have pain walking, hiking uphill. However, any suggestions? So I did talk about the walking. So that is just, start slow, walking is important. So yes, do walk, but just kind of start nice and easy, and know that if you're having SI joint pain in the first 5, 10, 15 minutes of your walk, usually that gets better and as it starts to warm up. And by minute 30, if you go for a 45-minute walk, you'll be walking back home feeling real good and like your body is working right. And that's because walking is one of the most natural, if not the most natural human motion, and it gets all the muscles working synergistically. Thank you, Sherry. All right. Sherry, thank you just for all the support over now, like, I feel like almost a full year. And you showed up yesterday on my thing that I presented for the functional anatomy. So it was great to see you there. Always great to see you, Sherry. So I think I'm not catching up in the chat. So we're going to do 3 more, and then I will go to the Student Hub questions. So we got, where do we go? Heather H. Yeah, so that's step 1. Get the bridge strong enough so that you can even get to the point of lengthening the hip flexor. So that you got your priorities straight right there. Moho Disco, is there a dynamic version of the bridge instead of the static bridge? Using the band does that some, but a 5-minute static bridge is unbearably tedious, and I'd love to be able to move while doing it. That's a really interesting comment, and I understand the motive behind it, because people that are in kind of a chronic pain situation like to move. They like to keep their body moving, and sometimes the static posture is a little bit unbearable. I've experienced that myself. What I've found, Moho, is that holding the bridge, maintaining the bridge, has much more of a long-term effect. It is active. It's not passive in any sense of the term. So it's an active stretch, even though you're not moving. It's isometrically active. And if you want to focus on something that's dynamic during the bridge, focus on your breathing. Focus on breathing down and into your lower back. That'll keep you challenged. But maintaining the bridge up there has more long-term benefits, with keeping those hip flexors lengthened for more hours and more days after you do it, than coming up and down in the bridge. And if you can't do it, if it's just not for you to hold the bridge and focus on your breathing, then you can come up and down in the bridge and turn it into a dynamic movement. You're still going to get benefits. So it's better to do something than, if you say, I'm not going to hold the bridge, so I'm not going to do it at all, then it's much better to do at least the bridge in some way. So that's how I feel about that. And then this will be number 3. I guess it's a double. So, and then we'll switch over to the Student Hub questions. I've been in the program a few weeks, consistently doing Module 1 and struggling, experimenting with various elements of Module 2. If it's okay, I have a number of questions. Number 1, should our core feel full or just contracted, not doughboy, during the bridge? That's a really good question. It should feel full, as in like filled with air, or full like you're full from eating. I'm not sure exactly what you mean, but I think it's a combination of both. I think that it should be full in the sense that you are engaging the deeper muscles. So you're aware of the get fat concept because you're in the program. So just checking with your hands while in the bridge that those side muscles, okay, let's just make sure right here, okay, and here, that those muscles are engaged and they're not doughboy, and I don't care as much about the middle 6-pack, right? It's not as important for supporting the spine. But that said, all of the muscles in the core with the bridge should be active, and you are using the 6-pack abdominals to pull the pubic bone to the sky, because that is a movement, right? And it's a movement muscle, so it should be contracted. So it's kind of like, I guess it's a fine balance. It's a combination of both. When I personally do the bridge, I am just trying to engage my abdominals pretty much to the max, and trying to breathe into my back and send relaxation into my back, and making sure that it's not just the six-pack. So full in the sense of, you're getting fat on the sides, but not full in the sense that you're pushing your belly out, like you're trying to pretend that you're pregnant or something, how people can push their belly out like that. That's not what I mean by getting fat. So don't want to have any confusion around what get fat means. You're not trying to pretend that you're full from eating or pregnant and sticking your belly out. It's locked in. There's a rope between your pubic bone and your rib cage, and it's taut. It's just that the muscles underneath are also taut, which causes the expansion on the sides of the belly. So hopefully that clarifies for you. And then we're going to go to the Student Hub questions here. I think I got to go up to this. We have Student Hub Students of the Week. We got 2 of them. Looks like Melanie M., and I don't know how to say the last name, Mcllrath or something like that, and Beth Morton. So both of you are the Student Hub Students of the Week. Congratulations. Melanie, thank you for working hard to understand and grasp the concepts taught in the program. We appreciate you posting in the Student Hub for others to learn as well. Beth, thank you for being supportive and supporting and helpful to other students on their journey. That is exactly what the Student Hub was created for. So thank you guys so much. We appreciate you participating and supporting others. It is exactly what we hoped for when we created the Student Hub, a place for people to collaborate and share experiences and learn from each other and to teach, because as I've found, that teaching others is actually the best way to learn, and so I encourage everyone to try and teach others what you're learning in the program and spread the knowledge. So you each get an extra month added to your membership. You have to do nothing. We'll add the month from the back end. So congratulations and thank you. So let's get into the first question we have for today from Matt Robertson. He posted it in the Student Hub. It says, I've had chronic SI joint pain. So this is right on topic with today's stream. For about 1.5 years after an injury when engaging my lower abdominal muscles in the past. Okay. I felt a gradual pulling sensation, which is painful and uncomfortable, localized to my SI joint or right below it. So the engaging of the abdominals is causing what it seems to be like your SI joint to be painful, or at least irritating or exacerbating it. I've concluded that it is bad pain. Good student, thank you for reading the FAQs, and I can tell that you have analyzed your pain and determined that it's not good pain, and we should not try and reproduce this kind of pain. It always gets worse the more I do the breathing into the lower back, even though I'm not consciously engaging my core muscles. The pain starts small and always gets worse gradually, so it's a very tough thing to work through. Do you have any suggestions? I do. I have some thoughts about this. So it makes sense to me, Matt, that when you're doing the breathing into the lower back, that it's like exacerbating the pain. And the reason is because it actually tells me that you're doing the breathing right and effectively, because when you're getting that expansion into your lower back and the back of your pelvis, it's expanding those SI joints. And actually what those SI joints want is to close. Those ligaments might be a little stretched out. That's really common for an SI joint sprain or a chronic, SI joint problem, is those posterior ligaments of the SI joint are most commonly the ones that are a little bit strained and overstretched. So when you're expanding your back and the back of your pelvis with your breath, it's just putting a little tug, probably not enough to do any damage, but enough to set off those pain signals, to just trigger those nerves, the nociceptors, and just say, hey, we're here, and we don't want you to do that. But I highly doubt that the breathing is causing damage
So those are my thoughts on that. It just makes a lot of sense to me why that's happening. So in the meantime, you might want to just practice a little less intensity with the breath. You can try sending it more just straight down into your pelvis rather than down and back, and expanding those posterior ligaments. Or you can just really, maybe take a little break from the breathing until you get that joint a little more stabilized. So the other thing is engaging the lower abdominal muscles. You said you felt a gradual pulling sensation. Okay. And the other thing you said is the pain starts small and always gets worse gradually. So it's a very tough thing to work through. So one thing I noticed is that you say lower abdominals, and I don't tend to separate upper and lower abdominals. So I like to, because they are ropes, right? And they go all the way from the rib cage all the way down to the pubic bone. I don't really consider breaking them like into half, right? Because they're longitudinal, and I don't see a point in doing more lower abdominal engagement than upper. I want the rope as a whole to be engaged uniformly. And so maybe it's just that there's too much force happening on the lower part of the abdominals, and the result of that is going into, unevenly into the tissues of your body. And anytime there's a force going through tissues of the body, it's going to find the path of least resistance. And so right now, any tissues that are compromised, like the ligaments in your SI joint, they're not going to offer as much resistance as fully intact ligaments. So it just seems to me like, if I'm just going with my intuition here, your intensity of the things that you're doing could be turned down, and you could maybe just consider doing the breathing a little lighter, the abdominal engagement a little lighter, the bridge maybe a little lower, turn down the intensity a little bit on everything. Try to consider more uniform or well-balanced engagement of the core instead of trying to target or isolate the engagement to the lower abdominals. And then also if you haven't, to watch the video on the activities to avoid, because those are things that could be contributing to the problem, keeping it going. And those are maybe more of the problem. And then these things that you're doing that are actually generally pretty good may just be exacerbating, or like you might be feeling them more because of these other activities. So I don't know if that makes sense, but this is just a period of time that you want to really lock in that SI joint. And so I would consider avoiding some activities for a while, for 2 to 4 weeks or something like that, and really focusing on the butt buster. I don't think you mentioned that here. So maybe go back and watch this video, or we do have the butt buster in the program, and spend like really committed, deliberate 2 to 4 weeks on just really committing to avoiding the activities that may be hurting, and really locking in those glutes. And if the lower abdominals are causing a problem, then focus more on the glutes, and then just kind of the whole abdominals. So hopefully that helps. I think I kind of repeated myself a little bit too much there, but that's okay. All right, we're going to do this question and one more, and then I'll look back in the chat and prioritize the people that are here live. So Patricia, I have this tremendous pressure in my spine with walking or standing. I have congenital scoliosis, and it has been fairly stable, no surgery ever, but this pressure is making it hard to function. My right and left sided pain has improved with the program, but the feeling of extreme pressure has not gotten better. If anything, with the thoracic extension on the foam roll, it may be a little worse. The pressure is mainly mid-spine. Can you direct me to any exercise that might help? Off the top of my head, I don't have any exercise that's going to help. I just kind of got to think this through for a second here. So Congenital scoliosis kind of means you've had it your whole life. Walking and standing cause the pressure, or you feel it more with walking and standing. The pressure has not gotten better. So pain has gotten better, pressure has not gotten better. Okay. Well, my first thought is, if you think that the thoracic extension on the foam is making it worse, then we're going to avoid that. Your body is communicating to you that it doesn't like that. If it's I'm assuming it's like a bad pressure and a negative pressure. So we're going to avoid that. But I would encourage, if there's one area of the spine where you feel this pressure, if it's localized to one area, and that one area is when the foam roll is on that area, it is where it gets worse. I would actually continue doing the foam roll on the other areas above and below that localized spot and try and get some more mobility in those areas. And I would just avoid the painful or high pressure spot. And with the goal of getting more movement in those adjacent joints to kind of take the pressure off that one segment. The other thing I kind of have to say is, have you had imaging? Because pressure, especially when you use like a term like tremendous, is not typical. And there's a possibility that there's a cyst or something grown in there. I don't know, but if I was in, if we were in a healthcare setting and I was your healthcare professional, I would be curious to just double check that. And when there's a feeling of pressure like that in your spine, it's a yellow flag. It's worth just looking into and making sure there's not like something that we don't know about that's causing that pressure. As far as other exercises, I would have some questions before I can actually answer that directly. So how does flexion feel? How does it feel to forward bend? Can you forward bend at that area of the spine? And how does that feel? Does it feel good? Or do you also feel the pressure with forward bending? Also, have you seen the video on it's kind of a YouTube video, but it's where we open up the thoracic spine through a stretch, and I demonstrate it on the floor. I don't even know what it's called, but it's thoracic mobility exercise, and it's on YouTube. So that's a good mobility exercise that doesn't include the foam roll, and it does tend to release pressure in the thoracic spine. I wish I could have the name for that, and if there was somebody on core balance training team that could look that up, who could just go to the YouTube channel and find the one where it's just relieving pressure or releasing pressure in the thoracic spine. Maybe we could get that posted in the chat, and then I could talk about it. So we'll answer one more question here, and then back to the chat. Karen Ottens, thoracic mobility on the foam roller makes me nauseous. Leaning my head back causes vertigo for me. I have never been able, I think you meant to say been able, to lean my head back without being nauseous. Any suggestions? So it does seem like vertigo, and it's positional, so that would be BPPV, benign positional something vertigo. And that is something that you can address through what's called habituation training. So you would want guidance. You would want to go to a professional, potentially physical therapist. Definitely it's within our body of knowledge, but you would want to go to a specialist like a neuro physical therapist. And you might find one of those in a hospital, or if there was a specialty clinic in your town, and go and do habituation training for vertigo. And what that is it's going to be gradually exposing yourself to movements that are not going to go past the threshold of throwing you into a vertigo episode, but will challenge that threshold. And that is the same concept of the program, is gradual progression towards being able to tolerate things like that more. And they walk you through it, and they take you through it over time, and they teach you the exercises. So vertigo is a whole thing, right? It takes place in the inner ear, and these little crystals in the inner ear, otoconia, and it's a little outside the scope of the program. But if it is affecting your ability to do the program, then it's something that should be addressed so that you can do the best thing for your body and get the most out of this. So that's my recommendation. I think the nausea could be addressed temporarily by maybe doing the foam roller up against a wall. And I also would maybe consider the ball that I have on top of my foam roller right there. It's a little mobility ball. They call it a trigger point ball, I think. And you can put that up against the wall and just lean into it and get just a gentle extension into the wall. But another thing that I want to just clarify is that with that thoracic extension, you're not really leaning your head back. So you might want to just do less head and neck motion. You could do no head and neck motion and still get the benefit of the thoracic mobility by getting that thoracic spine moving over the ball or the foam roll. So that would be a good modification for now, but you do want to address the vertigo if possible for you. So let's take a look into the chat and see how far back I fell. We'll go here. Okay, so 1-0. You have more difficult in doing the front anchors than the back. Does mastering the front anchors would help with your upper trap tightness, rounded shoulder, and forward head? The answer is yes. So typically, most people will have more difficulty with one or the other, either the front anchors or the back. And in the short term, it's beneficial to do the one that comes more natural to you and build up some core strength. But in the long term, the more important one, the key that's going to unlock a lot of the pain and the imbalance, is to learn how to do the one that's more challenging for you. But you build up your core connection a little bit with, for you, it would be the back anchor. Build up that core connection and then lengthen those hip flexors. And then, really focus hard on the front anchors. And that, yes, it will help with upper trap tightness, definitely directly rounded shoulder and forward head, but indirectly it will let those muscles, if you're really doing it through the thoracic spine, it will let these muscles kind of let go and feel safe to stop protecting, because you have more movement, more contribution happening from below the neck, because these muscles protect the neck, and they really don't want the neck to move too much when they lock up like that, because we tend to overuse our head and neck. All right, Lawrence just started module 2. Program is a total game changer. Great to hear. Happy to hear that. And just gratitude. I'm happy to have you, Lawrence, and sending it right back. So thank you for being here and committing to your body. Yeah. Lynn just started the program. Thank you. Modifications for core activation and bridge technique with left AIC pattern that is contributing to SI joint pain. Left AIC pattern. I don't know if I know what that means. Let's see. Left anterior, inferior. I need clarification, or I could look it up real quick if it shows up for me. Left hemipelvis. Oh, okay. Okay. So it's just the left hemipelvis is rotated forward. So it's kind of like anterior pelvic tilt on the one side relative to the right side. Okay, and I guess this was coined by some guy that founded the PREI trainer. Okay. Anyway, I get what you're saying. And yeah, so there's going to be modifications when you have a left-right imbalance. I do believe it's important to prioritize getting the front to back balance first. So sagittal plane stability first, and then address left-right imbalances. But if you are already into like module 3 and 4, you're going to want to just identify the side in the front anchor or the back anchor challenges where you're having more difficulty, and you're going to want to spend more time on those sides, because these are asymmetrical activities. And anytime you're going to have a pattern like that, there's going to be imbalances in the muscles that are pulling you out of that way. And so you'll most likely find imbalances in the strength and or endurance of those muscles. And whichever one is weaker or has less endurance, you're going to try and just spend more time on, more focus on, and try and balance that out. And that's going to be a general rule throughout the course. But it is more important to get the sagittal plane stability first, so you don't get a twisting effect that tends to happen if you try to address left-right imbalance without stability in the sagittal plane. Sue, the back anchor challenge dead bug movement is the absolute most beneficial so far for me. The engagement in my core totally makes sense. The mind body link is fantastic. All right, Sue, thank you for sharing, and thanks for the enthusiasm. We love it, so really appreciate that. Stephanie Peel, my problem started with bilateral quad rupture, so fear is a big part of my challenge. Stephen Peel. Okay, bilateral. Wow. So anything when it's bilateral, unless you had like a trauma, like a physical trauma, like a car accident that caused that, then that's different. But if it's a bilateral problem like that, then it definitely points to this global pattern of imbalances. It's happening equally on both sides. And wow, yeah, I actually haven't heard of that. So that's just kind of like a extreme form of quad dominance, maybe, that led to, is it tendon rupture? Is it which quad? There are 4 quads, right? So is it one of them, or I can't imagine that it's all of them. Would be curious about that. But yeah, fear is a big part of everybody's journey, and so you want to make the decision first, and if you're going to do it confidently, whatever you do. All right, how are we doing? So Brenda, my lower back spasms, if I try to push through it, I can't keep walking. It'll take me down. So as a prior walker, I would love you to use walking as healing, but I can't. Okay. Is it an SI joint problem that you're dealing with, Brenda? Because my walking, like continue walking advice is specific to SI joint pain. It's not really specific to lower back spasming or muscle problems. So when you're having spasming, it's, could be for different reasons, but one common reason is that the muscles are tired, and they're protecting, and they're locking up, and the way that we're using our body when we're walking is heavily using those lower back muscles in our walk to protect our body, to engage, and it may be totally unconscious. You are not aware of it. You don't even have control over it. And so what you want to do to be able to walk is to do some floor stuff. Okay, you want to use the floor as a tactile, like basically a way to align your posture, and you can use it to get those lower back muscles to relax, and then follow it up with walking. And so there's a really shortened version of the answer, which is I don't know if you're in the program, Brenda, but it incorporates the things that we teach in module 1. So the back anchor progression does get those lower back muscles to kind of relax and lengthen a little bit, and that's why a lot of people will feel relief from that exercise. So you would follow that up with walking with those muscles already having been relaxed a little bit, and the abdominals are a little more engaged. Maybe you can walk 1 minute further than you did before, and that's progress, and you want to build on that. But yeah, typically my thought is overusing the muscles. They're tired. They just start to spasm because they're giving up. All right, Sherry. So we'll end with you, and then we'll go back to 3 more questions in the hub. So you say, caught your segment of framework for functional anatomy yesterday. It was great, and I hope many more who can benefit from your program saw it and decide to give CBT a try. Oh, thank you so much, Sherry. You know, that framework for functional anatomy, it was actually for other healthcare practitioners. So my even greater hope is that these practitioners will just open their eyes to a new way of looking at things, maybe even go down. I said at the end, I was like, I hope you go down the rabbit hole on some of these concepts, because we covered a wide range of concepts in that half-hour segment. And I hope that they do that, and then they can pass this stuff on to all of their patients and their students, and it can spread that way. So yeah, it was a great little segment, and I did see you there, Sherry, and I saw your supportive chat message. So thank you for being there and always the support. So let's go back to Student Hub questions, and we're going on an hour, so we're gonna finish up here. And we have Mark Brower. So we have 3 more questions in the Student Hub, and then I'll try and catch up in the chat. Mark says, thank you for developing this program. It seems like it was developed just for me. So that is an awesome comment to receive. And it probably means that you have a similar body type to me, Mark. And I was in this pattern, this predictable pattern. And so it was developed for you, because it was developed for me and my problem. And it just so happened that my problem was a lot more widespread and common than I thought it was for the first 5 to 10 years. So you say, I'm still learning how to apply it to my bend over sports, skiing, biking, golf. Find my back anchor for support while keeping my hips soft or nimble is tricky. Any thoughts? So it's going to be an ongoing thing that you are going to continue to work on and try and improve forever. So that's my first thought. But the real focus, like my 100% focus when I'm bending forward, is, are my abdominals and my glutes driving the motion? And even if it's bending forward, right, and gravity is actually the thing that's pulling you down, are they controlling the lower? So kind of resisting the gravity. And are they the primary drivers, the first couple of the abdominals and the glutes? And if they're not, then the tension is going through other tissues. And I don't have control over the tissues that tension goes through unless I'm actively tensioning those tissues. So if it's not going, if I can't feel gravity or the resistance to gravity or the lift, if I'm lifting, if I can't feel it going through my abdominals and my glutes, it's most likely going through the least path of resistance, which is most likely the weakest link of the chain in my body. And if I'm dealing with a compromised lower back or SI joint, then it's going to be that. And so I want to control where the tension goes. And the only way I can do that is to create the tension before it just naturally flows through my body. And the muscles, the healthy muscles that I want to do that with, whether I'm in a sustained forward bend position like skiing, or even just bending forward, like in picking up a golf ball, or lifting something, I want the drivers of my motion to be abdominals and glutes. So that's the best thing I got. I am going to be talking about golf in the next slide, so more on that in a second. And then biking, not ideal for the body, but if you love it so much, then I would recommend cross training with bridging before and after, or some other activity that is training the body in a more open position. I personally do bike. I do some mountain biking, but I definitely feel it in my quads, and I feel like my body is a little out of balance after I go for a long ride, and so I have to do some cross training. So make sure you are incorporating something that's more open than training in the fetal position, because that's what biking is. Also, you have a 15-year-old granddaughter with scoliosis. Her doctors have taken a wait and see position. Would your core balance training program work for her? Yeah, I think it should. Definitely, I believe in addressing this younger. The younger, the better. And so this isn't limited to adults. It can be effective. Actually, infants and babies did this program naturally because that's what we're trying to model after. So even the youngest people on the planet are doing core balance training. If we modeled after them right, they're doing it, and we're trying to mimic that. And so really any age can do it, and I think it definitely can be beneficial. So I hope that she does it, and yeah, thanks for thinking of her. That's part of this, is sharing this information and spreading the word. So thank you, Mark. All right, so to the golf questions. Chris Dobbins and Nelson Coyle. So say, just finished module 4, can now sleep at night pain-free. Thank you. You're very welcome, Christopher. Thank you for sharing that. A question about golf. Golf would seem to be counterproductive on my work, trying to stabilize my lumbar spine, L5S1 degenerative disc. Can I ever play golf again with full rotation of my spine, or should I modify my swing into a more hip, thoracic, cervical rotation with a stabilized lumbar spine? And when should I consider swinging a club again? I'm extremely protective of my lumbar spine right now to control sciatic pain. And Nelson says, is there a back brace you would recommend for playing golf? Lower lumbar bulging disc issue. So we're basically, both of you are dealing with a similar thing, which is, a compromise in the lower lumbar region, whether it's a bulging disc or a degenerative disc. The cause could be exactly the same. It's just that the disc is resulting in a little bit of a different compromise. But how do you swing a golf club with something like that? So the first thing I want to say is, I was talking about this earlier. I'm going to go full screen for this. With any activity, and golf is one of the main ones that I would say this is really relevant for, is if you're going to do it with confidence. So the worst thing that you could do is do an activity that you should not be doing and injure yourself. Okay. The next worst thing that you could do after that is do an activity that you could be doing, you might be able to do without injuring yourself, but you do it in a way that is overshadowed by fear, or fear is on your mind. And so to do that activity with fear of hurting yourself, when you could have done it without hurting yourself, if you did it confidently, is the next worst thing. And that's because doing things with fear or with a protective mindset while doing them actually changes the way that the body functions. It changes the muscles that engage, and you are engaging more of a protective pattern of muscles, which includes the hip flexors, which is the antagonist in this whole battle that we're fighting against in the predictable pattern of muscle imbalances. And there's a lot of other muscles too that are protective muscles that are going to be just a tiny bit more engaged, a tiny bit more electricity going to those muscles because of what's going on up here. And so I strongly recommend, instead of doing something that you are not really sure about whether you should be doing, and doing it with fear, I would recommend, before you're going to do anything, and we use golf as an example, so before you swing that golf club, decide in your head, should I do this or should I not do this right now? Based on all the experiences that I've had leading up to this, I have some knowledge and wisdom about my body. I have some body awareness. Should I do this or should I not? And if you decide yes, that you're going to do it, then do it with confidence, because you're going to be engaging the most healthy core supporting, spine supporting muscles that you can use to do that activity. And if that activity is just a little bit too much for you right now, and you feel like it could hurt you, then just decide not to do it, rather than doing it in a protective way, like partially doing it. So that's number one with a golf swing. The other thing I want to kind of talk about is the progression. So a golf swing does not mean driving a golf ball. It could mean putting. It could mean chipping. It could mean an iron. And so that's the progression that I would take in my journey to return to golf. So to answer your question, Christopher, I believe, yes, you can get back to golfing again. I don't know the extent of your injury. So is golf something that I would start doing in my life now? Because I did not golf before, probably because of my back pain, but I probably wouldn't get into that sport because I know it's kind of extreme on the spine. It's a combination of rotation and extension, which is an extreme position. But I have a really similar story with surfing. Surfing is really extreme. It's more extension than golf in the pop-up, and rotation in all the acrobatic maneuvers you do to turn on a wave. And that was what injured my back for many years, and it caused me a lot of problems. And I worked my way back gradually to surfing again, and I can now happily say that I don't have any restrictions with surfing anymore. I surf the waves I want to surf. I surf the big waves. I surf the small boards. But for a while, I was just doing a longboard on small waves. And then I worked my way back as I got more confidence in my body and more strength in my core and more mobility in my hips and my thoracic spine, which is relevant to both golf and surfing. So to answer your next question, should I modify my swing in more hip, thoracic, and cervical rotation? Absolutely 100% yes to these two. Cervical, it's not really that necessary. If you have more movement in your hips and thoracic spine, which is probably what you should have, I say should, what would have been beneficial since the beginning, and not just to you, but to all golfers, to get more hip mobility. This was relevant to me with baseball, with my swing. If I could have gotten more hips into it, less twisting would have gone into my back. And guess what? The hips are more powerful than the L5S1. They're probably 100 times more powerful. So you're going to get more power in your swing from having more functional rotation and mobility in your hips. And the thoracic spine is going to be able to allow you to follow through better, and it's going to free up your shoulders a little bit, and it's going to take the load off your lumbar spine. So 100% yes. Cervical, I would just let the neck do what it's going to do, because a lot of people have overuse injuries in the neck as well. And that's for the same reason, that there's not enough mobility here. And these are surrounding the lumbar spine. So getting more mobility and function, like strong mobility in these regions, will improve not only golf swing, but everything really. So yes and yes. And then when should I consider swinging a club again? So it's that gradual progression. So you're going to want to look at starting out with putting, and then you're going to do long putts, and then you're going to do short chips, and then long chips and irons, and then drivers. That could take a year to go through that, but or longer. That's the way I would do it. And then we spoke about this. So this is really, really important. If you decide you're going to do it confidently. And so Nelson, all of that applies to you. And then you also want to know about a back brace. So the only back brace that I ever recommend, and we're not talking about an SI belt right now, we're talking about an actual lumbar brace. The only one I would ever recommend to anyone in any situation is a corset brace. So something that just applies 360 degrees of pressure all the way around, and just provides you a little bit more stability. And it's the same thing with like a knee brace. I really am not, I don't see a lot of benefit unless you have a acute injury to your MCL in braces with hinges, metal hinges and metal brackets on the sides. They don't provide stability in only in one direction do they provide stability. So it's more appropriate for a knee, but with the lumbar spine, you want just a little compression that will provide stability in all every possible angle that you could bend and twist and swing. And it's the same thing that we're trying to do with our abdominals. We're trying to create a corset with our deep abdominal muscles and the breathing and everything we're doing. So you don't want to put a brace on in place of your abdominal muscles, because that would create a dependence, and those muscles would atrophy and get weaker. But with an activity like golfing, where you're only wearing it during the time that you're golfing, maybe it's a few hours a couple times a week, that's not going to make those muscles weaker, and it's going to provide a little support. So for both Nelson and Christopher and anybody else as a golfer that's listening, I'm not really against using a corset during the time that you're doing an activity that could potentially be extra stressful on the spine, but I don't recommend it all the time. And I do recommend doing some training on the side to activate those muscles and get those hips to be able to move a little more. And so that's kind of the stuff that we do in the program. That's the goal of the program. But artfully and strategically using a corset brace, you can get it at CVS. You can, it doesn't really matter. It's just pressure. You want one that you can pull tight and squeeze your abdomen and breathe into it, and you'll feel the support that it gives you. That can be a very good thing when you use it only during the times when you're doing something like golfing or, moving from one house to another, right? So hopefully that helps. Then we'll go back to the slides. We have one more question from Liz. She says, I find hip rotation control really difficult. So this is actually relevant to the golf question that I was just answering. So it is difficult, not only to get hip mobility, but to be able to have control in that range of motion. You gain a new range by stretching, but can you function in that new range? Can you control the movement through that new range? It's not easy to do. So that's okay, Liz, that it's difficult. It's like my hips are locked, especially when trying to engage for internal rotation. I don't get very far at all before it feels like my hips are stuck. Then it feels like the rotation wants to go into my knees or my back. The cue is twofold. So I already have something to say, but we'll read your question and see if it's in alignment. How do I increase range of motion, particularly for internal rotation, and why would there be such a difference between my range of motion when comparing internal versus external rotation? Okay, all right, so I'll answer the question specifically. There is a lesson in the program where we are doing, I don't remember what it's called, but it's hip active stretch. I think that's what it's called. And you're kind of in a position where one hip is out and one hip is turned in. And so we're actually training external rotation on one side and internal on the other side. That's one of the better stretches that I know for increasing internal rotation of the hip. The problem with hip internal rotation stretches is they tend to really be a lot of stress on the knee. And so there are other stretches that you can do, but I've found them to cause a little pain in my knee, and I'm not into causing problems elsewhere when you're trying to solve another problem. So this one in the program is the best one that I know of. I think it's called hip active stretch or hip rotation active stretch. And I would be focusing on the one that's being rotated internally and actively applying that active component to the stretch so that you can learn, gain the range with the stretch and then learn how to contract the muscle in that new range. So it is in the program. Maybe you missed it or maybe you forgot about it, but that lesson does stretch internal and train internal rotation. Now, the second part of your question, why is there such a difference? Well, it could be anatomical. So there are people that have anteverted hips and there are people that have retroverted hips. And so it's called it's kind of related to the Q angle of the hips. And so some people are just a lot more prone to having great rotation in one or the other, internal or external. So for me, I have more retroverted hips and I have better external rotation. and really poor internal rotation. So that might be the same thing for you. And so it might just be an anatomical thing, but you're asking why. And I can't really give a great answer to that. I think there is an element of DNA, of right, genetics, but there's also an element of just the way that you were brought up through life. We have a student in the program who emphasized the importance of the frog leg position in raising an infant and a baby, a developing child. And so getting them to be able to be in that position often in the early months of life and the early years of life. So that, that is a factor as well. And then depending on how long you've been on this earth, just all of the experiences that you've had of, how often did you ever get into that position? How often did you need it? But it's definitely correlated with chronic back problems. Hip mobility is a strong factor. If you have limited mobility, that motion is probably going to go into the lumbar spine because that's the next thing up, or the SI joint is the next thing up. So a lot of people have SI joint pain too. So just to give you a little insight into my beliefs about that. And so, yeah, I would revisit that lesson on hip active stretch. I don't know the exact name, but hopefully you can find it. It's probably in one of the last modules. And then the hip rotation control is difficult. So after the stretch and you gain that new range, because you're not really going to gain range from this. This is a motor control exercise. So after you do that stretch, follow it up immediately with this motor control exercise and try and train that new range and gain the control, and think of it as a long game. So maybe today is your baseline, and tomorrow you might have a tiny 1% progress, and that's good, because that means if you can get 1% each day, then 100 days from now you'll have 100% progress. So that's the way I would look at it, and hopefully that helps for you. So that was all the questions in the Student Hub. We'll take a look back into the chat. I don't know if I'll be able to catch up today, because I gotta cut it off at 1:30. So I apologize if I'm not able to get to your chat today, but I do have an engagement that I have to get to at 2:00. So I have to cut it off in 7 minutes basically. So Heather is just showing gratitude here, and I'm grateful that you're here, Heather. Corey, bodybuilder for over 10 years. It's a very powerful extension-based sport. Now, after postural movement analysis, I've been told by 2 physical therapists that I'm stuck in extension. Yeah, so Corey, we have a similar history. I started bodybuilding when I was 13 years old, and I continued not for 10 years, but probably, until my back problems started, and then I continued maybe another year after that. So until I was probably 17 or 18, I was bodybuilding, and I can relate. So yeah, I will be telling my story and talking more about that in a future live stream. Neighborhood gripes. Your info is amazing. PT locally told me the SI joint doesn't move enough to cause pain. I pointed to it as where my pain was coming from. Was misdiagnosed for 15 years. Yeah, it's a bummer, but I'm glad that you found us, and I'm glad that you're here, and thank you for sharing. It is a common belief that the SI joint is just, I don't know. There's a lot of different beliefs out there. I have my own. Don't trust me. Just do your research, listen to everybody, and then make your own judgment, make your own opinion. And if the stuff that I am saying makes sense to you, then maybe it makes sense. Yeah, because it makes sense to me. So Corey, both focused on reestablishing flexion throughout my spine and strengthening anterior core. I'm wondering if this might be why the front anchor doesn't feel great with upper lower extension. Yeah, because your problem is a result of chronic repetitive extension. Going into extension doesn't feel good because your body is like, enough of that. I don't like that. But really what you got to do in the long term is learn how to go into extension in a healthy way through your hips and your thoracic spine, and not so much through your lumbar spine. It's just further ingraining my already extended posture. Is it possible that I should skip the extension portion of module 2? Maybe temporarily, but like I said, in the long term, and I kind of mentioned this earlier in the stream, you want to eventually long term spend more focus on the anchor that is more challenging. So if it's the back anchor, is that, but for you it's the front anchor, and you like your long-term game is to be able to do the front anchors really well, because it trains you how to extend in a healthy way, and you need to be able to extend to do a normal functional life. And if you don't learn how to extend, then in the times in your life when you need to look up or drink out of a cup or reach in a certain way, it's going to go into the lumbar spine, and the problem's going to continue. So you've got to learn how to do it in a healthy way. Patty, you have RA, any help please? That'll be another topic for another day, because that's a really big topic, but I'll try. I'll put it on the list for you, Patty. Asti, I believe, oh yeah, hopefully that's the link. I don't have time to check it because I only have a few minutes left. Would bird dogs be bad for SI joint stability? That's a good question. On topic, just me. Bird dogs are asymmetrical, and so in that sense, temporarily in the very beginning, if you're like real early on in SI joint problem, you might want to avoid something like that, but they are not extreme. They don't go to end range. If you don't go, I don't recommend you go to end range with that exercise. It's going to be okay. It's just not, I just wouldn't do it in phase 1. I wouldn't do it in the first 2 to 4 weeks of SI joint recovery. I would save it more for a phase 2 thing, and really focus on the symmetrical bilateral stuff early on. But bad? No, not inherently. It's within range of motion. It's not to end range, and you can really get an amazing amount of core connection and training when you do that. It's in the program. We call it the front anchor challenge, because we take a different approach than you take in a physical therapy clinic with bird dogs. Very different focus with the exercise. Wing Ding, do you recommend using ice or heat on the SI joint? Heat is going to loosen it up. So I like heat a lot, but it increases blood flow and oxygen, and I use it on my own body. But you use heat to loosen things up, and most SI joint injuries they move too much. They're hypermobile, so I wouldn't necessarily want to be loosening up a hypermobile injury. Ice, sure, if it reduces the pain and it kind of does the opposite of heat, right? It might help to like stabilize it a tiny bit, but it's a very temporary thing, and it's not going to have a whole lot of impact on anything else. Like there's not a lot of swelling that typically happens in that joint. So ice just can help reduce pain and feel good. And so I don't have any problem against it. Rebecca Perkins, Ryan, I messed up and got lazy in day-to-day movements. Back pain has returned after approximately 18 months. Wow, that's amazing, Rebecca. You went 18 months without back pain. I am impressed and proud of you for being able to get to that point. So laziness happens, life goes on, right? There is no solution to back pain where it's like, I reached the end and I'm done. I don't have to worry about it for the rest of my life. I can just treat my body like crap. I'm not saying you're doing that, but we never get to that point. The journey continues, and you always have to be mindful, and life is a series of ebb and flows, and you already know that. So you got to ride the wave and got to get back up, and I'm glad that you're here. I'm glad to see you resurface and see your name again. And I hope that you are active in the student hub and help. You can see all the students that have now joined the program and help guide them, and just participate, because that will help you learn. That will help you keep motivated, and you can also just be part of the community that's starting to form here. And just encourage you to get back into it. I'll be looking for you. I'll be watching out for you and keeping you accountable. 1-0, which exercises in the CBT program would help you have more resilience with sitting? That's a fantastic question. That's a big question. I don't know. I don't know the answer to that, but I'm going to think about that one. And I know you show up every week. So if I can remember, I'm going to get back to you on that. And maybe you can ask it again. You can challenge me next week. By the way, I got to wrap things up, but it looks like I'm catching up in the chat. So hi, Juan, a sitting video. Okay. Yeah, that's the, hopefully you've seen that. Thank you, Austin, for sharing that. Jonathan, can you do planks with SI joint pain? Well, planks, traditional planks are going to really stress the SI joint because basically what's happening is this is the midpoint of your body. This is your hip hinge. If you're planking, gravity wants your hip to go like this, right? It's pulling you down. And the only muscles that really effectively resist that are the hip flexors. And the hip flexors pull directly on the SI joint and the lumbar spine. So the answer is yes, but you want to work up to it. It would be a end phase 2 exercise. So you want to really lock in your core connection, your abdominal strength. I would have those glutes squeezed as tight as I possibly can and be trying to use the glutes and the abdominals to hold myself up. And for as much as possible, if those hip flexors are yanking on my anatomy, that they're pulling against a rock solid connection with the glutes and abdominals. So the answer is yes, but artfully. Patrick, I've realized the relationship of hip mobility to my herniated disc and spine. I can't get my brain to let my body move though. This is a 90% mental battle that we're fighting, Patrick. So don't give up. Know that it is a lot mental. And so it's going to be just a gradual reintroduction of activities that were scary, and also the timing of that is really important. So it has to be very gradual. And I don't know if I think you're in the program because I've seen that name before. But yeah, this realization is a massive breakthrough. So congratulations. And you can now move forward in the rest of your life having a better understanding of the relationship to your hips and back pain. So yeah. Which module does that hip stretch show up on? I'm in module 9 now. That was Liz. So that is, it's got to be module 9, 10, or 11. I think it would be 11 if I might be wrong. It might be 10. Whatever module is about hip and shoulder mobility. That's the module that it's in. So hopefully you can find that. Module 11, day 1. Oh yeah, there it is. Thank you, Asti. Would your program help me avoid having to have the ReActiv8 device? I don't know that device, Indy. But typically, I'm not a huge fan of devices because they are outside of your body. Even if they're like surgically implanted in your body, they're still external to your brain and the relationship that your brain has with your core. And that's, for me, is the long-term solution to back pain. So a device is bringing in something external, and it's going to take away the opportunity of you, not completely maybe, but partially reduce the opportunity for you to learn how to operate this body better on your own, which is, I think, the only long-term solution to back pain. So we're going to end with that because that's definitely my belief there. And we made it. We caught up in the chat. We made it through all the Student Hub questions. We went 1 hour and 35 minutes. And thank you all for being here. I don't even know if people are still here, but if you are, thank you for being here. If you found this useful, feel free to support the stream, hit the like button, subscribe if you haven't already, and share this with anybody who you love or care about, who you think this could help. You can copy the link or just hit the share button and send it over and help spread the word that there is a solution to chronic lower back pain and SI joint pain. And until next week, get down on the floor and connect to your core. All right, take care, everyone.